Hi everybody. I just wanted to give you share a few points today about how to maybe stay a little safer, feel a little safer in these trying times. So I want to first show you how to properly wear a mask. If you've noticed on TV, as I have, so many people are wearing them incorrectly. So in order to be safe, we have to make sure that we're putting the mask on correctly, putting it on, taking it off, and I'll show you that towards the end today. So first of all, if you wear glasses, I usually like to put my mask on before I put my glasses on because then I can adjust it around my nose pretty well. But let me show you here. The top has a little stay in there that you bend, and try and conform that to your nose as best you can. And of course, your loops go around the ears. So make sure that you're pulling it under the chin and that you have this stay kind of molded around your nose. If you have a problem with your glasses steaming up, if you do wear glasses, just pull it up and try and mold a little more, and that helps a lot. If you notice, this mask has a few gaps, okay? I learned something from a colleague the other day, and I'll share that tip with you in just a second. First things first, always make sure the nose and the mouth are covered and you've pulled that down around your chin. I see this a lot, which isn't doing anyone any good, and I see this a lot. If you think about all the aerosols and pathogens that might be coated on the front of this mask, and then you have it down here, you have all of those pathogens now on your face. So always make sure you have it up, pulled around, and you're good to go. Okay, the gaps. I have a trick here that, like I say, a colleague showed me. Okay, so you just have a paper mask and you would fold it into like a little boat. Then you want to tie the ends, the ear elastics, as close as you possibly can get to the mask. Tie a nice little tight knot, just like that. Okay, we'll do both sides. And then you want to open it up, and then it actually does look like a little canoe kind of thing. You fold the sides in, flatten them out to both sides. And then you're able to put it on, and it'll be a lot tighter fit, kind of like a KN95 mask or an N95 mask that are so hard to come by and so expensive. So this is the next best thing, actually, filtration, not filtration wise, but protection wise. And you'll see the difference in how tightly it fits now against my face. Make sure to pull it around the chin, but you can see the difference. There aren't any gaps, so that might be something that you want to do. Okay. All right, let's do a little hand washing. I know when my students, I say, I'm going to teach you how to wash your hands, and they say, we know how to do that. But there are a lot of different ways to do it. Sometimes they keep telling you to wash your hands occasionally, wash your hands. But there's really a good way to do it to make sure that you're covering all areas. So first of all, you want to start, we're really lucky in our clinic because I can push the water on, so I don't have to worry about contaminating my faucet. But I will show you in a little bit how to disinfect that after, okay? So you're going to wet them first. And I'm going to use the back of my hand to get my soap. I'm going to soap them up a little bit first. Now when you do this, you want to sing to yourself the happy birthday song about 2 times. And that's about 20 seconds. That's the minimum. Okay, so we're going to be really careful here in how we do this. I want to make sure that I'm doing my thumbs. In the palm and in between my fingers. Now I want to do the backs, and again in between my fingers. And then I want to make sure that I'm getting all around the cuticles. Those are areas where a lot of pathogens like to hide. Okay, so I'm going to do this. And then I'm going to take my fingers and try and clean the ends there around my cuticles on each hand. We tell students to do this twice. It's always a good rule of thumb. And then when you rinse, you want to rinse this way. Of course, if you have anything that you've missed or kind of halfway gotten off, if you do this, then those pathogens won't be on the fingertips, but more around the wrist, which is better. And then we're going to dry thoroughly. You have what is called transient bacteria that are on the hands all the time. And those are the ones that we're removing. Okay, now we're going to put on some gloves. I want to show you how to put them on and take them off. The idea is not to cross-contaminate. Once you have one area clean, you want to make sure that you keep all areas clean. And we go back a second time, and I'll show you that here in just a second. So the gloves are on. Okay, I want to do just a little bit of disinfecting. And they talk about doing this. Some people are doing it with their groceries. I am. But we want to make sure that we're not cross-contaminating when we do that. So we're going to do a flat surface here, just to give you an idea. A lot of people will do this. Okay, so you're missing a lot when you're doing these big circles. The idea is to not touch anything with your clean gloves, okay, other than your disinfecting cloth. But we're going to do overlapping strokes to make sure that we've covered all of the area. And besides, they talk about the aerosols with the COVID-19. They can be anywhere. And as a matter of fact, hepatitis B can live on a surface for 30 days. So if you're doing this and you miss a spot continually, then you have that pathogen there available to make anyone sick. Now, if you wear glasses, you need to be cleaning them on a daily basis. Don't clean them with disinfectant. I don't know what that might do to your lenses, so good old soap and water is just fine. If we are going to disinfect the sink, for instance, this is contaminated, okay? So I need to make sure that I'm not cross-contaminating. I've got two cloths. I'm going to be really careful that I'm not touching my clean gloves on anything that's contaminated. So I'm very careful about how I'm going to prepare this. So make sure after you wash your hands, you can turn your spigot off with the paper towel that you've dried your hands with very carefully, and then go back and make sure that you are disinfecting. And your soap container as well, and the container that you used to get out your disinfecting cloth. So that way you're making sure everything is disinfected and clean for the very next time you're going to start your whole disinfection, hand cleaning, and mask wearing for the day. And everything's thrown away. Okay, so I'm going to remove my gloves. This is a little bit tedious, but very simple to do. You want to pinch the glove towards the wrist. These are dirty now, okay? You want to completely remove it without touching my hand. You're going to be touching the inside of the glove now, okay? That's what's been touching your skin. You're going to very carefully take one finger and slide it under the glove without touching the outside, and completely pull that one off, and then you've got both of them that you can just throw away. And then of course I'd wash my hands again. Okay, so we have removed our gloves, and now I want to show you how to properly remove your mask without cross-contaminating. Remember, the mask will now have a lot of pathogens on the front, and we want to make sure that we're safe and careful. So after the gloves are removed, the only thing you're going to touch are the elastic earpieces, just with 2 fingers. Don't ever pull your mask off like this, because of course then you'll have the pathogens all over your hands. So we just remove it, and then you want to place it for use later this way on your paper towel. Of course, if you did it this way, again, you're cross-contaminating. So this way, everything is good. Then I would wash my hands a second time, and we're finished. The thing I wanted to remind you of, always wash your hands before you place your gloves on and immediately after removal. I hope that helps. I hope that helps you feel a little safer, and I'm happy to be able to help. If you have any questions, just get in touch with me. I'll be happy to help. Thanks.